Wegovy, Zepbound, and Phentermine all reduce hunger, but they solve different problems. Phentermine is usually cheaper and may suppress appetite within days. Wegovy and Zepbound usually produce larger long-term losses over a full year. The best choice depends on your target, risks, budget, and ability to continue treatment for months or even years. Their different mechanisms also shape speed, side effects, and long-term fit. Wegovy's Semaglutide mimics a fullness hormone. Zepbound's Tirzepatide acts on that pathway, plus a second hormone released after eating. Both reduce calorie intake and slow how quickly food leaves the stomach. Phentermine instead increases norepinephrine, a brain chemical tied to alertness. Despite those different mechanisms, the starting weight thresholds are similar. Treatment is generally considered at a body mass index of 30. It may also be considered at 27 with a weight-related condition. Body mass index means weight adjusted for height. Weight-related conditions include high blood pressure, sleep apnea, or type 2 diabetes. Beyond who qualifies, treatment duration matters too. Wegovy and Zepbound are approved for long-term weight management. Phentermine is federally approved only for short-term use, described as a few weeks. Some clinicians prescribe it longer, but longer use lacks official approval. Duration can also distort the comparison. Phentermine may suppress hunger within days because it directly stimulates the nervous system. Wegovy and Zepbound start at low doses and rise gradually to reduce stomach side effects. Early scale movement, therefore, does not predict the final result. Expected weight loss creates the largest gap. In a direct 72-week trial, Zepbound averaged about 20% loss. Wegovy averaged nearly 14%. The 7.2 mg Wegovy dose was not included. At 200 pounds, those averages equal roughly 40 pounds versus 28 pounds. Phentermine is harder to rank with one number. Its supporting studies are older, shorter, and different from modern injection trials. No strong direct trial compares Phentermine alone with either newer drug. Claiming an exact percentage winner across all three would overstate the evidence. The useful pattern is clear. Wegovy and Zepbound have stronger modern evidence for larger sustained losses. Phentermine can work well for selected patients early in treatment. A strong first month does not prove it will match an 18-month result. That difference matters in practice. Consider two patients who each want to lose 40 pounds. One needs about 10% loss to improve mobility and has limited insurance coverage. The other needs about 20% after repeated regain and has insurance support. Their starting choices may differ. Phentermine may fit the first patient if blood pressure is controlled, heart disease is absent, sleep is stable, and misuse risk is low. The second may fit Wegovy or Zepbound because their average losses are larger. Price matters, but the required amount of weight loss should be defined first. Defining the number is only half the plan. Weight loss means little if side effects or cost force treatment to stop. The strongest drug on paper can become the weakest real-world plan. A smaller result that lasts may protect health better than loss, followed by rapid regain. Wegovy and Zepbound commonly cause nausea, diarrhea, constipation, vomiting, or stomach discomfort. Symptoms often appear during dose increases. Persistent vomiting can cause dehydration or make adequate protein intake difficult. Neither drug is recommended for severe gastroparesis, meaning very slow stomach emptying. Wegovy and Zepbound should not be used with a personal or family history of medullary thyroid cancer. They also should not be used with multiple endocrine neoplasia type 2, an inherited tumor syndrome. Severe abdominal pain can signal pancreas inflammation or a gallbladder problem. None of the three drugs should be used during pregnancy. Phentermine causes a different side effect pattern. Dry mouth, constipation, nervousness, tremor, headache, and insomnia are common complaints. It can raise heart rate or blood pressure. Taking it late can disrupt sleep and poor sleep may increase hunger the next day. Phentermine should not be used with uncontrolled high blood pressure, heart disease, glaucoma, overactive thyroid, severe agitation, or a history of drug misuse. It cannot be used within 14 days of monoamine oxidase inhibitors, an older antidepressant class. The combination can cause a dangerous blood pressure surge. As a controlled drug, it may have stricter prescribing and refill rules. Even when a drug is safe enough to start, the plan must cover what happens after stopping. Appetite often returns after any of these drugs stop. Many people regain part of the lost weight. That reflects returning appetite signals, not addiction or weak willpower. That makes treatment purpose important before the first dose. A short course may improve mobility or support preparation for a procedure. Durable control requires a medicine that remains tolerable, affordable, available, and effective. Treatment length should match the reason treatment started. Once the time horizon is clear, define how much loss is needed. The key number is the gap between your current weight and a meaningful health target. Someone needing 5 to 10% loss has more reasonable options. Someone needing 20% usually needs stronger average weight loss. Health benefits beyond the scale can break a tie. Wegovy lowers major heart event risk in certain adults with established heart disease and excess weight. Zepbound treats moderate to severe obstructive sleep apnea, repeated breathing pauses during sleep in adults with obesity. Phentermine alone lacks those specific long-term approvals. Those approvals do not make either newer drug automatic. Severe nausea, repeated dehydration, or major stomach emptying problems can make Wegovy or Zepbound impractical. Palpitations, uncontrolled blood pressure, or severe insomnia can make Phentermine unsafe. A strong trial result means little when the body cannot tolerate the drug. Turn the comparison into a practical checklist. Start with medical safety, then confirm cost, supply, routine, and follow-up. This avoids choosing a drug that looks ideal in trials but fails in daily life. Confirm access to timely dose changes and side effect reviews. Safety history narrows the choice first. Check blood pressure, pulse, heart history, sleep, glaucoma, slow stomach emptying, gallbladder history, pregnancy plans, and current medicines. Not every item blocks treatment. They show which risk pattern is easier to manage. Cost and logistics can overturn the preferred choice. Confirm monthly cost, insurance rules, refill reliability, dose availability, and follow-up. A lower-cost Phentermine tablet may fit one routine perfectly. A weekly Wegovy or Zepbound injection may fit another routine better. Convenience is not just injection versus pill. Weekly injections require storage and supply planning. The Wegovy tablet has specific fasting and water instructions, while Phentermine requires consistent morning dosing. A convenient format only helps when its routine remains realistic every week. If Phentermine fits that routine, the trial still needs checkpoints. Track weight, waist, blood pressure, pulse, sleep, mood, and hunger. Change direction when side effects outweigh benefit or early loss is too small to justify continued use. Raising the stimulant dose is not the answer to every plateau. Wegovy and Zepbound need similar checkpoints. Dose increases should follow tolerance, not impatience. Persistent vomiting, dehydration, severe abdominal pain, or inadequate protein intake requires review. More loss is not healthier when treatment causes weakness, muscle loss, or repeated urgent care. Phentermine often wins on price, oral simplicity, and speed. Wegovy may win when its proven heart benefit matters or when it is better tolerated. Zepbound often wins when larger average loss or sleep apnea treatment matters most. Choose a treatment with manageable risks, enough benefit, and a sustainable routine. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.